house physician in New York City. Dr. Sue Decotiis joining us now. Doctor, thank you so much for Decotiis joining us now. Thank you so much for your time. This is such an important topic in our country because, let's face it, obesity is a problem in this country. Everybody rather take the pill, take the shot, do whatever, because it's easier at the end of the day than hitting the gym or putting down the chips. You know, all of us have a little, most people have an extra little they want to get rid of. And Oprah has embodied that for 30 years, publicly, no less, as someone on television. What were your thoughts on her message last night, even as she declines to say which drug she's using?
I think it's a message of hope, and so many overweight and obese people have been struggling with this as she has in front of their family, friends, and colleagues. Let's realize that if people could take it off on their own, they would. I practice in New York City. My patients are pretty sophisticated, pretty disciplined. Most of them have tried extensive diet and exercise programs, and it doesn't work. They can't take the weight off on their own. These medications are expensive, so people don't do this for sport, okay? So these people are really committed. So it's really important to realize this is a disease, and I think that's something that Oprah pointed out. Even if you're not obese, if you're overweight or if you tend to binge eat, it's a disease, and we have to look at it that way. When you have that constant food noise and you can't get food off your mind, even if you're eating healthfully, it's a problem. And the underlying issue that people don't understand, it's not about what you're eating, it's that you're insulin resistant. So insulin is a very important hormone, as we know. It's made by the pancreas. It works throughout the body. Too little of it causes type 1 diabetes. If it's not working well, you can have type 2 diabetes or just be overweight or just be hungry all the time. The other thing is when insulin is not working, you cannot burn fat. So that if you're trying to diet and go to the gym, it doesn't work, because when you're losing weight, a lot of times you're losing muscle because your body is not metabolizing foods efficiently. It doesn't really know what to do. It's kind of confused. When you go to the gym, you don't get great results and you get really tired. So that's why so many people drop out after 6 weeks at the gym at the end of January. So we have to realize it is a disease, and now we have hope because it can be treated. So I think it's just a wonderful thing, and I've treated thousands of people with these medications, but the caveat here, it has to be done properly. People can't just be getting these medications from an app or from a physician that is not really trained in medical weight loss and expect to have successful fat loss, not lose muscle,
right,
and be able to keep it off. So those are the really key points here.
I think that was a huge concern, because when Ozempic, let's say, became popular online, there were diabetics that need Ozempic that weren't able to access that because so many people said, hey, okay, I will be able to drop some pounds here if I use this. And that obviously is a concern of, okay, well, if someone really desperately needs it for a medical reason, like diabetes, like you were saying, and they can't get it, then that's a huge problem. But I want to talk about this part of the special. It profiles a young girl that was prescribed one of the weight loss drugs and how she was able to lose a significant amount of weight in just a few years. So when we're talking about kids in this, how early, at what point do you start having that conversation with your doctor about introducing a drug to alleviate this?
Well, with a child, as we know now, the American Academy of Pediatrics has approved the use of these drugs in children over 12. But I would be very, very cautious. For a lot of children, diet and exercise is very, very important, because we didn't have this years ago. We didn't have all these obese children 30, 40 years ago. So I think when they see their pediatrician, one of the first things that the pediatrician, especially a weight loss pediatrician, is going to do is really go over very carefully how this child is being fed. What kind of calories are they consuming? Are they consuming sodas? Are they consuming fast foods? How much are they exercising? So that really has to be looked at first. And that child has to be supervised on a very strict diet and exercise program with their family very, very involved before we put one of these children on these drugs. But many children will need these drugs. So we can't say it's a bad thing. And again, as we know, it's not always lifestyle.
But in a nutshell, it is telling what you just said. We didn't have kids this size 30 years ago. So what has changed about what Americans are eating? Is it too much McDonald's, too much soda, not enough exercise, everyone's on their phone or in the video game machine? In 10 seconds, what is it? Why are our kids bigger these days?
It's our food supply. It's not just junk food. It is the chemicals in our food, and it's what's in our soil. So they started introducing chemicals into our foods in the 1930s. So our grandparents and our great-grandparents were consuming these foods. And that's when we slowly began to see obesity. We really didn't start seeing it until the 70s, and then it really skyrocketed after that.
Interesting.
And again, all of these things, all of these chemicals cause insulin resistance. That's what we're seeing. So if we're just talking about improving the food supply, that's wonderful. But how are you going to do that? It's like curing poverty or attaining world peace. Good luck with that, right? So let's just treat the problem. And that problem is insulin resistance. And that's why these drugs work. Now, some people are going to be much more sensitive to these chemicals or lack of nutrients than other people. I'm sure there are genetic factors involved in this. However, if someone is insulin resistant, they need to be treated.
All right, weight loss physician, Dr. Sue Decotiis, thank you so much for joining us. We appreciate it.
Thank you.
All right, a new memoir, Pope Francis